Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
In healthcare, there's often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share our nursing perspective without taking up too much of your time. Today, we're joined by our return guest and star of our series, Becoming a Midwife. This is the Charity Bean, entrepreneur and founder of the Doula Lab. This will be her third time on the show. She's already told us about her journey to being a midwife. She's come on and told us all about the founding of the Doula Lab. And today we're going to catch up and see how her academic experience is going. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner, and one of your co-hosts here at the Melanin Initiative podcast, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it to manage your health and advocate for others. It's our hope that by watching on YouTube or listening on any of your favorite podcast apps, they'll be empowered to ask questions, educated on how you can manage your health, and confident to navigate the healthcare system. That's our primary goal for starting the show. Our second mission is to elevate the expertise of nurses, to increase awareness about all the health professions in the industry. It's a huge industry, and Charity is going to be able to share one of those other ways you can be part of it and continue to do the great work that's so necessary. Every day, there's people entering this industry straight out of high school or a second, third, fourth career. You come in with different ages, different experiences, different perspectives, and we need that. And we want to just give you a point of reference, give you some inspiration, hear how other people have navigated this route, and learn about people who can be in your network to support you in your journey. If you haven't already, this is your chance to subscribe, leave a comment or two, give us a thumbs up. It helps the algorithm see that this information is important, so that when people like you look for topics like this, we'll show up higher in the search results. This show is for educational purposes only. If you haven't already, hit the notification bell so you can be notified when we release new episodes. And just remember, the opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you think you might be having a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you or someone you know might be having a mental health emergency, you can call 988 or text 741-741. Charity Bean is a force in maternal health, a certified pregnancy, labor, childbirth, and postpartum doula who specializes in hospital births. With a remarkable 15-year career in healthcare spanning primary care, trauma, psych, emergency medicine, and birthing units, she's dedicated her life to transforming maternal care for Black families. She's the founder of the Doula Lab Pregnancy Resource Center in Belleville, Illinois, and the owner of Doula Bean Maternal Care, LLC. But that's not it. She's also a bi-state maternal and infant health advocate working to address disparities in Black maternal health. She's not just raising awareness, she's actively building solutions and communities. This year, she embarked on a journey to become a midwife, pursuing her Bachelor of Science in Midwifery at the Midwives College of Utah. Her ultimate dream, to open a freestanding birthing center in St. Clair County, Illinois, ensuring safe, supportive care for BIPOC families. From her personal experience as a teen mom to her extensive medical career, her passion for birth work is unmatched. She's on a mission to be the change our healthcare system so desperately needs. So grab your notebooks, because today we're diving into an inspiring journey, and we're going to continue to see how she is tackling becoming a midwife. Charity Bean, welcome back to the Melanin Initiative.
Thank you again for having me. Always wonderful.
Yes, we know you're very busy as a woman in the community, making huge impacts, and a student and a mom. So we greatly appreciate the time that you spent with us. We're just going to jump right into your episode. We'll have the link to your previous episode so that people can hear the backstory. But just in a brief snippet, if you could kind of tell us who you are and what you do.
So my name is Charity Bean. I am a full spectrum doula, a lactation counselor, community health worker, certified medical assistant, and currently, of course, a student midwife. I'm the president and founder, CEO of the Doula Lab, my baby, my passion, my not-for-profit organization, which is a pregnancy resource center. And then, of course, the owner of Doula Bean Maternal Care, LLC, where I offer doula services, as well as going to speaking engagements, teaching, event planning and coordinating, conferences, you name it, I do it all.
And so before we jump into your questions, we're going to do our new segment, 5 questions in 5 minutes. We want to give a nod to the host of Maker's Mindset, Nancy Twine. She does this with her show, and I just thought it was really fun. And so first question is going to be, let's see, you said, what does it mean to build community?
To build community means to eliminate silos, to get outside of your comfort zone, network, meet with others, and basically kind of open your doors, open your hearts to others who can help be a part of your village. Again, you're not going to be able to do all the things. So building that community and leaning on others is going to help you start to, as my good friend Kyra says, to thrive and not just survive.
The last hardest decision you had to make?
Earlier this year, I had a cousin fall very ill, and the decision to start dialysis treatment like immediately right then and there, so suddenly and abruptly, or to not. So it was hard, it was scary, and of course I went with started immediately. So that was probably my hardest decision this year.
That was for your family member?
For a family member, yes.
Oh, I see. They wanted your input?
He was intubated. Everything, it was a big thing, all happened so fast, and they were like, we need to make this decision right away, or his kidneys are going to shut down.
So, and how are they doing now?
He's doing great. He's doing much better. He's on, doing dialysis and things out of the hospital. It was very scary. Like, it just went from totally fine, you might got pneumonia, but your kidneys are in jeopardy, to all of a sudden I come back up there, and as I'm walking in, they're starting to have to intubate him because things just escalated, scared me to death. So that was one of my hardest decisions this year, I would say.
Thank you for sharing. And so speaking on that, who do you go to when you need help?
Yeah, still working on that. I with my family, I can call my parents and things. I will give a shout out to a woman who's near and dear to me, Pam McDonald. She's like another mother to me, like that elder energy that you really need and that nurturing. So she is someone who I can call and talk to, and just being in her presence just kind of uplifts my spirits.
Speaking of uplifting, what is one book that changed your life or your perspective?
1984 by George Orwell. Definitely changed my life and my perspective on the world and like America, how we think, the things we do, things like control. I almost threw away my Alexa because of that book. So I kept it. But yeah, 1984 by George Orwell. It was written in 1948. And it kind of like gave future predictions of like, things like we kind of do now, like how we're controlled by like social media, our cell phones, electronics, things like that. That actually really changed my life and my outlook on like, again, how the mind and things are controlled. It's a really good book.
Okay, thank you. And then the last question is, who would you like to give their flowers to?
Who would I give my flowers to? You know what? My brother. I think my brother is like the most phenomenal man on earth. My dad, shout out to my dad, next to my dad, but my brother, he's my little brother, but he's bigger than me. Juwan Bean. I just love him. I love everything. He's a great husband, a great father, an amazing brother. He is like my best friend. So I would definitely like to give a shout out to him, flowers to my little big brother, Juwan.
Wonderful. Shout out to Juwan.
Thank you.
You came on earlier this year and told us your motivation to going back to becoming a midwife. So today we're going to just pick up where we left off. And if you could just tell us, what are the role and responsibilities of midwife?
So a midwife provides care during the prenatal period into childbirth and into the postpartum period, right? We support birthing families, throughout this experience, we provide that clinical care. So not like an OB. So an obstetrician is considered is someone else who you would go to, like for example, you have like high risk or things going on that will require you to see an obstetrician. Now midwife is again someone you can see if you have what we call a quote unquote, as I say, textbook fairly like normal pregnancy, no complications. There isn't like, let's say you have uncontrolled like hypertension during pregnancy. Well, you'd have to see like a obstetrician as well, like high risk physicians. So yeah, we provide care, we provide love, we have support, we have a whole different model of care that versus the medical model of care.
And where are you in your curriculum?
I am finishing up my first year. I'm so excited. I leave in 2 weeks to go to Salt Lake City, Utah to do my assessment checkoffs. I'm in an amazing, very busy clinical setting with Dr. Adrena Beatty, who is mentoring me. She's an obstetrician. And then I'll be headed into a midwifery clinic setting with Talia Whittington and Jennifer Killian at Mercy Birthing Center. So it is chugging along. I got about 2.5 more years after this. Just going through it. I'm ready to start officially catching babies.
Oh, I've heard so many of you all say that. It sounds like a wonderful, wonderful career choice.
Thank you. Thank you.
So let's focus on this last semester. So is it like 16 weeks?
Yes, so it's 16 weeks long. They're kind of broken up. They start in like coming up, like we got January, we go through January through April. You get like a 2-week break in between before May, beginning of May, then you start again and you like go through the summer. So we got these 3 trimesters: winter, fall, summer, and fall semesters.
Trimesters.
Trimesters. Yeah, they said trimesters. I was like, oh, that's different. I thought I was tripping. I was like, do we mean that? They were like, no, we prefer to say trimester. I was like, oh, I like this school. So yeah, that's it full time. Of course, it's online. So you do everything. It's a lot of responsibility, because you are more so doing the things on your own, not necessarily reporting to class. So that's a big thing. And then of course, going, to your clinical setting, because you have to do all the finding of these things kind of on your own. And I know a lot of programs are like that, but it's just, it's a lot of responsibility on your own to stay on top of things and really make sure, you're hitting these things in these spots that you're supposed to, be at those points. So wrapping up my first year has been such a whirlwind and so exciting to be at this point, like in clinic now. Like I never thought I'd be doing pap smears, but I'm in there like, hey, speculum in, doing my thing. It's so exciting. Like I can't explain it.
I love how excited you are. So in the beginning of the semester, they give you a syllabus, right?
Yes.
And for our students who are being inspired and listening, and we want to help give them tools that they can use too. How do you take advantage of that access to that syllabus in the beginning of the semester?
Oh, I am that guy. So I may not be always organized, but one thing I have to do is have the syllabus. I need to know what's due and when, because of, again, owning the Doula Lab and all the other things and events coming up. So I have to be able to plan things out at least 6 to 8 weeks ahead. And of course, being that I'm in the clinical, communicate, with my preceptor said, hey, I can't come this week because I got a big exam, schedule time to study. Also compare my life with being a mom. My son is 17. He is a full-time basketball player, student athlete. There's another life here, guys. I'm telling you now, when they get to high school, my God. So making sure, things kind of coincide with that, because of course I want to be present and support him. So read through that syllabus, making sure you understand the requirements. Also, so you don't get reprimanded or turning in things that don't meet criteria, but mostly planning.
And so do you keep organized something like a paper calendar or planner, or do you do something digital?
So digital has become a new thing for me, and I am trying, but I'm still an old school girl, still have a planner, multicolors. And for me, and I believe my severe ADHD, that still works for me, because I start my day, try to open it up, look at it, see what's due. Digital, I think, just becomes kind of sometimes so overwhelming, because I try my best not to. You open your phone, then I mess around and maybe look at a social media app, or like, oh, let me respond to that email right now when I should be focused on studying. So I'm still of a planner girl.
Okay. And then do you coordinate, because you're working full-time?
No, I work actually part-time now at Mercy Hospital, where I provide lactation services, women's education, love it. And then, of course, I give the Doula Lab ample time. And then, of course, I have my time in for clinic setting.
And at work, what is part-time? What is that considered?
So for me, it's like 16 hours
Okay.
a week, just to keep things consistent, just in case things get a little slow. As an entrepreneur, you will have those moments, right? So, and also giving myself grace and flexibility with school, because again, as an entrepreneur, it does take a lot to make sure you continue to get income and things coming in. So I go to work occasionally just to make sure things don't all, tilt the opposite way.
And work is pretty accommodating for your schedule, it sounds like.
Yes. Oh my God, my boss is one of the most amazing people on earth. I love Jody Forsman. She is one of those people who will, if you got a goal you're trying to reach, and she supports education and going to school. So as many times as I've had to change, I've gone from full time to PRN, part time, back and forth, just finding ways to make it flexible. Even being able to change my schedule for me, where I had to just recently work weekends only, 12-hour shifts, to make sure I was like meeting that medium criteria, for benefits and things of that nature. So work has been very supportive, and I just can't thank my boss enough, and my director, Lizzie. They are amazing.
We thank them too, because that's a huge stressor that can be relieved, just by having that. You spoke about benefits. So with those hours that you're working, do you get CEs or tuition reimbursement?
Unfortunately, my school isn't on their list of tuition reimbursements, because they have certain ones that they're contracted with, and that's totally fine. But they do support, like, for example, each department has like money available. So let's say if I'm going to a conference, or, certain things when I submit it to them that I need to, have a little extra support for, they're able to accommodate and do that. Like, they have, thank you God for them, like the NRP training and like the CPR things that were required for school. But I didn't have to pay out of pocket for that, because my job covered it, because, it's kind of like a part of the job. So just having the availability to do a lot of those things that they cover has been amazing. But mostly I'm talking like healthcare benefits, dental benefits, because of course, even in school, life is going to happen. Like my son had to have emergency oral surgery like a week ago. And I'm like, thank God for benefits.
Okay, wonderful. Yeah, thank you for sharing that. And then, so what classes did you take this last semester?
Oh, this last semester I've taken public health for nurses, which is what I was so excited for that class, because I love public health, right? I mean, not nurses. Ooh, merciful. Public health for midwives. And I also have taken my last Clinic 10 wrap up 2010, which is just kind of finalizing everything we've learned throughout the year, preparing for that assessment that we're going to be taking in Utah. And the other class was stats. So it was stats for midwives. And it's been, I'm a big nerd. I love research. Okay. I love it. No offense to nerds. It's a great thing. In fact, as a Black woman, we say blurred. All right. So a Black nerd. And being able to really dive in, and they opened up my eyes to more actual like research websites and things with, articles, journals that's been published, make sure we're getting that factual information and things peer reviewed. Mm-hmm. And that was just the greatest. So right now I finished my PICO question, and I'm doing this big presentation next week on my question about, continuous midwifery care during labor versus obstetrician.
So you mentioned a vocabulary word for our audience, PICO. Can you just explain what that is?
Oh, yeah. So PICO is one of our things with statistics, where you create like your research question. And with that, you're going to dive deep. So like P, you break it down. So P or PICO, however you want to pronounce it. P for population, I for intervention, C for, she's going to kill me. The brain part, what the C part was for. And then of course, O for observation. So I want to say, I just really can't remember what the C is. That's so embarrassing.
That's okay. And what's the title of your research question again?
So mine is continuous. What did I say for the population? Of course, is during pregnancy. So I said continuous monitoring during labor with the midwifery model versus obstetrics. Like, so basically saying, is it necessary for you to have that continuous monitoring going on while laboring? In the midwifery model, you don't, because we don't have any interventions necessarily going. Now, again, there are levels to midwifery. So like birthing center, home birth, you won't be strapped to monitors and things like that. We're going to, use a Doppler and things to palpate the contractions, right? Versus when you're in the hospital setting, and everything is based so much on interventions and, mechanical and making sure, how are things going constantly, having to look at things and intervene. So my question is just trying to show the difference between the care and see, based on the research, does it provide better care, or do we have better outcomes where the mom isn't necessarily restricted?
So when we look at our PICO question, your population would be
the birthing, the moms, the laboring moms.
And the intervention is
monitors.
And the comparison or control.
There we go. My goodness. Oh goodness, this would be in obstetrical care. So like in that model of care, the hospital setting.
Mm-hmm. And then the outcome, what you're trying to measure
is who has the better outcomes. So does this literally lead to better outcomes being monitored or not monitored?
What would those outcomes be?
The labor satisfaction, basically saying how that person had a better outcome during their labor, whether they were satisfied. Did it, do you feel like this person, like being monitored, helped decrease anything arising? So I'm reading all these journals, trying to see the evidence that they have based on a few studies that's been done about continuous monitoring versus, not being monitored as much, being able to move freely, helping, find an enjoyable experience with their labor experience. So looking for the outcome of what is that experience, like the pleasure or, how did they enjoy their labor experience?
So the patient experience, really. So that's a qualitative measure, or are you getting any quantitative or numerical data?
So far, qualitative, I've been really researching, and then it kind of sparked me to say, how can I ask that? Like including like myself now, I almost want to put my own study together just to kind of compare and contrast in hospital versus outside of hospital setting. And I think I am going to be able to do that here soon if I get everything in play and present it like at my job. How can we measure satisfaction with this and see what people are experiencing and feeling with monitors versus no monitors and moving freely?
Yes, I'm big into research too, and one thing I'm looking forward to is once you get the Doula Lab internship going, that your interns will help you get published more frequently. You'll get invited to do more talks, and that will just further solidify you as a key opinion leader in the Black maternal health space. So when we talk about research, there's two kinds of data. We have the qualitative, right, where you might be asking those questions about satisfaction, and people might give a short answer, so words. But they can also rate that satisfaction using things like agree, disagree, neutral, strongly agree. And we can give those numbers associated with the narrative, the words, and then we have a numerical data. Or you can have actual numerical data, like the number of changes in vital signs or preterm labor or pain rating. So actual numbers, and you can do both mixed method studies, right? I'd be really curious to see what you come up with, and we look forward to hearing about that later down the line.
Oh, I can't wait. I will definitely send it in. I'm excited. I'm putting my final touches, getting everything together. I need to submit it before my birthday.
And so what does your typical week look like when you're arranging, work and school, learning on your own, studying for exams, writing papers, going to clinical?
My typical week, so Monday starts the week. I usually give Monday is my day of quote unquote grace, aka like admin, doing things for like office. So let's say I say from 9 to 12, I would do things that I need to do admin wise for the Doula Lab. And then after that, because I noticed that I'm at my peak around 1 and like 4:30 of like alertness and can like really take in information. So that's like my study time. So Mondays and Tuesdays, that's generally going to be the days of studying and get things together. Now my cutoff time has to be no matter what, 5:30. Just because my son will be coming home from basketball, trying to either bring home dinner or have dinner ready, something of that nature, or going now to attend his basketball games, which I had to add to my list. And then I go to a clinical setting on Wednesdays, Thursdays, Fridays. Those are the busier days. So I'm in there from like 8 a.m. Now it's about 30 minutes from home. So it's a nice little drive to St. Louis to get there. And so I'm there from like 8 a.m. to about 4:35 p.m. with my preceptor. Love it. Busy schedule. Wednesdays and Thursdays are usually the OB days. Like Fridays are like women exam days. So just things. And other than that, like just adding things in, like when I get off, sometimes I'll come home depending on what assignments are due. Like maybe I have to put the finishing touches on a presentation or, set a deadline to write papers. So I usually just kind of schedule things in based on the need.
And on that commute, are you taking advantage of that to listen to any textbooks or lectures?
All the time. So depend, like early mornings, not gonna lie, I have to listen to a little music to get me going here. But by the time I'm headed home to kind of help like take everything in and calm my mind, I am a big fan of osmosis. Okay. Love osmosis, that education. So I can like listen to it while I'm driving and like review things like even stuff I may have learned today or further research it if I just heard of it, right? Something comes up. Playback lectures that maybe I missed because I'm in clinical. So luckily for me with this school, you don't have to be present for every lecture online, but you do have to go back and watch the recordings and, type in the discussion board what we discussed. And so the beauty of being able to play back those lectures, making sure I kind of took everything in, really is helpful when I'm driving.
And osmosis, you're referring to the YouTube channel?
I believe they have a YouTube channel, but they actually have an app. So they have an education for all levels, everything from nursing to all the way to like even physicians. It is amazing. And shameless plug for them, guys. If you are in any school, nursing, PA, doctor, I don't care, midwife, utilize this app. It has everything from anatomy on up to literally breaking it down how you should think in the role. So like, we'll do fetal monitoring. Like there's one on there for fetal monitoring and explaining what you should be looking for in your role, what to expect from the moms. And it's not just so medical model. It even talks about like, mental health of things, making sure you're addressing these. Did you notice that? I think it's just the best thing since sliced bread. And I don't know how long sliced bread has been around, but I like it. So, it's so convenient. Like that seems to be something that people had like a hard point in, like where you get to the point of like you take in all this knowledge, but nobody really tells you how to really, really apply the knowledge and think like you should in that role. So I feel like it really helps enhance that critical thinking and really putting things into aspect when you're actually doing the work at that moment.
Is it free?
No, you have to pay a fee for it. And I mean, again, I don't sponsor for them or none of that. I'm just telling y'all that it's a great deal right now for Black Friday. It's like 60% off for their membership. So you can like pay it up front, or I think it's a monthly fee. I just paid it all up front when I caught a deal last time. So as a student, it was 50% off. And I believe it was instead of like $200, it was only like $99. So for a whole year of access to unlimited videos, they even transcribe. You can go in and print things as you need it. It's just been amazing.
Wonderful. Thank you. Yeah. I used to watch their YouTube videos, and I don't know if at that time, if they had the app, but this is wonderful. So great to hear. And, reach out to them. You never know if they're looking to find a partner.
I should. I would love to tell anybody, like their YouTube channel was great, but literally if you get this app, that's the part that's missing. It really breaks it down for you. So definitely you can use YouTube, but definitely look at the app.
Thank you. Because I hear about UWorld all the time. But yeah, I hadn't heard about I hadn't heard anyone else mention osmosis in a long time, so I kind of forgot about them. But I used to love their content, really well put together. How far in advance do you typically study for exams?
I try my best to give myself at the minimum 2 weeks. Yes, especially because usually you get a window. Like when I'm looking at the syllabus, like I know the test is on this day and we're going to be covering this and that information. So at minimum, I give myself at least 2 weeks to go back to things that maybe I didn't understand, because you move on, of course, to the next thing. So if I find myself needing to review something, like one thing that kind of stumped me for a minute there was like pelvimetry. And I was trying to like really gather that and understand like the pelvis and the shapes for a moment there. Like I thought I had it. And then I took the test and I'm like, well, how did I mess that up? Right. So going back and reviewing before the big final exam where I knew it was going to come up again. And again, it may seem odd, but I learn better by what I miss. So when I miss it, I go back and it makes it really stick better with me. Right. I couldn't tell you why, or at least I think that at the time when it was being taught to me, maybe it just did not click. But when I miss it and I realize that's something I missed, I do my darnest to go back and just really embed it in my brain and try to retrain my brain to find methods of studying that'll make it click for me. And I actually learn better by teaching, which sounds so crazy. I'm teaching my clients to talk about the pelvis. I'm like, I just learned this in school.
The best way to see where your gaps are is to put yourself in a teaching position, put the things that's what we tell our patients, put it in your own words. That's how I'll know you get it. But as the student, sometimes we don't take that same advice, but it's my number one advice. I talk about it all the time. That's why I started my own blog, the Mahogany Dermatology blog. So I'm putting myself in a teaching position to share. And yeah, it will increase your retention tenfold by doing that.
Yes, it totally does. I love it. I'm like, oh yeah. And they like my people laugh at me all the time. They're like, what? I'm like, it clicked, y'all. I know what I'm doing.
So let's talk about your clinical. So when you show up on that day, do you have to do something to prepare? What does that look like?
For me, and I'm actually kind of, which is wonderful, I'm ahead in clinical. So I'm very much a hands-on learner. We haven't even touched base in school just yet in this first year, but it's coming now in second year on a lot of things I've been doing in there. And some of it, which basically being based in the first year, is things I've already been doing, like vitals, the basics, teaching, assessment, the basics. But now being in the clinical setting, once it's time to apply that knowledge to test taking, now I can say, oh, I'm ahead of the game. It makes sense to me, like doing pap smears and things that I've been doing, which I just love. Like even learn how to do copos, working with Dr. Beatty now. I'm just observing a lot of it, but like inserting like IUDs, things like that aren't necessarily required for my program. But when the things come up, I now have the knowledge because I've done it so repetitively that I'm like, okay, I got this, right? One thing I'm so proud of, I could find the baby with I went from like nervous to, oh, there's a baby right there, looking at the heartbeat. I'm like, you hear it, knowing where to be. And again, I know it's coming up in school, but being able to, because I've been working with her and I love that she's such a great teacher, like, go get in there, you got this, right? And I'm like, do I? She's like, you absolutely do. So just having that for me works better. Now I used to tell people I kind of learn backwards. I got to hands-on do it, experience it first, and then go back and read, and now it makes sense to me.
That's nice. And so through each patient that comes through that day, are you always being supervised? How does that work?
Yes, always being supervised. I'm still in that phase where you have to have the supervisor available. By your third year, they allow you, and if your preceptor will allow you, to go ahead and go on your own. Now, she does sometimes allow me, like, oh, you can go in there and start the conversation. That part, no biggie. But to actually do some of the hands-on things, other than like a breast exam and listen to their heart, I won't do unless she's present.
And do you have access to the medical record?
I do, actually, yes. I have my own login, which was a part of the clinical agreement and setting. So we use Epic. I'm able to log in under my midwife profile. And, she helped me set up even my little notes that'll pop up for, different things, what the person is there for that visit of. And it prompts, those notes so I can fill them in and continue to talk and see my clients. It's really, I just light up thinking about it. I'm like, some days I'm in awe. Like, I know I spoke it before, but like to be in those roles in that moment, it just, I can't explain like the great feeling of like, wow, this is really happening.
I'm so happy for you. Did they already have a midwife at that clinic?
They don't. And that was pretty awesome. So a lot of questions have been arise. Like, am I going to stay there? Will I be there? As I told them, I was like, I can't say yes or no right now because I have no idea what God has in store for me, as well as laws are changing, because generally you would have to be a nurse midwife. But I, by the grace of God, was lucky enough to be allowed as a CPM student to be in these clinical settings that normally they would not allow. So power of networking, people. You better get out and talk to people. You never know who would be able to do something for you that could change your life, right? And help you out in these moments. So I say that to say that because laws change every day, just like in the state of Illinois, CPMs are now legal, right? And starting in January 1st of 2025 can build private and Medicaid insurance for services, birthing centers, and home births. That's a game changer. So as I tell them, I'm like, I mean, if that's what I'm supposed to do, sure. When I get close to graduation, I don't know what the laws are going to be, maybe. But if not, I have another plan.
Wonderful. And if you could just refresh our audience on the difference between midwife, what you're doing, and the nurse midwife.
Okay, absolutely. So I'm doing a certified professional midwife. That's direct entry midwifery. And what happens with that is you go straight into midwifery without having to be a nurse first. That's something that's actually also offered more commonly in the UK. The UK has straight to midwifery options versus you having to be like a nurse midwife first or a nurse first before going into midwifery, but you can do both. And there are just limitations on things based on where you live. So like in the United States as a CPM, and also what state you live in, some states don't allow you to write prescriptions. and some do. And even then, there's still limits to what you can and can't do. Same as it would be for like, a nurse midwife. Maybe you can do this, but this next step has to go over to like an obstetrician, right? As a nurse, as a CPM, you can work in birthing centers, and you can, in some states, own your own birth center if you would like to. You can work in clinics. You can do clinic setting if that state does allow and allow reimbursement for it. And of course, do home births. Now, a nurse midwife can do them all, but their training does not cover how to do a home birth. They would have to go get outside training on how to perform home births.
Thank you for sharing that. It sounds like you're having a wonderful time. Actually, during that rotation, that day that you're there, you're wearing scrubs. You get a lunch break. Do you take notes? Do you get, after the day's over, do you sit down and chat? Like, what does that whole day look like?
It's like being around family. It's such a great time. And I love the community that I'm in, which is Ferguson, Missouri, which is a very underserved community. Also a very highly African-American populated area. So I couldn't be in a more perfect place for myself. Again, I love to see everybody.
This is the Ferguson, right? The Ferguson.
Yes, the Ferguson, the Mike Brown Ferguson. Yes, ma'am. Mm-hmm. This is Ferguson. And it's just amazing, right? From start to finish, I'm surrounded by women of color, even as a staff member. So it's a beautiful thing, right? My preceptor is a woman of color. And so from the time we start, once we get in, we get rolling. I follow her throughout the day. She is a very busy woman because, again, there's not very many women of color in this work. So you can imagine how full her schedule is when people are seeking a Black woman for their, gynecological and obstetrician care. So I do get a lunch break. I go to lunch when she does. We eat together, or we'll, eat with the crowd. We go over, like, let's say when it's lunchtime, we'll go over what we did that morning. I have the free space to ask questions, talk about things. If she gets a call, it has to go to the hospital because she's on call. I grab my bag, I'm right with her. We go to a delivery, right? And then if we got to come back to clinical, we come back to clinical. So as of right now, I'm doing like the 8 to like 4:30-ish thing. And then starting next semester, I will totally follow that midwife who I'll be with, her schedule. So if she's on for 24 hours, I'm on for 24 hours, but I am allowed to sleep and things like that with it. I know it's crazy. Or if I'm at home and, she's at home, like, we got a birth coming, I'm on call today. You got to stop what you're doing. And you got to head that way to make it.
Wow. And do you have a way that you keep log of what you're seeing and the hours?
Yes, I have school galas, outline log of what you're supposed to fill in. So everything from women's exam things are included. I have so many prenatal visits you're supposed to do in like each year. So many births that you have to have done to graduate the program as well. Postpartum exams and newborn care. So we have a nice list of things that have to be completed in order to graduate.
So outside of EPIC, where you do your documentation, and outside of Osmosis, where you do your studying, I learned about any like clinical resources that you can use at the point of care to like identify treatment, do patient education, learn more about the disease or process yourself, like right there?
There are different actual things in EPIC that you can click on. So like, let's say, for example, if it's a medication, even though I'm not prescribing it, but if I need clarity on the medication, there are like links, hyperlinks in EPIC that I can click on right then and there that take you to like the websites that you can go to for verification. And they have certain ones that they only allow you to go to not just Google, because Google is a whole, we're not Googling everything, guys. Google Scholar, okay, if you're going to do it. I have different books from school that I use, like Heart and Hands, Midwifery, labor, different little booklets and things that I actually have and I take many notes on. And I have been researching things that I'll have printouts that I've created for myself to help me along, little notes and just a lot of things. Even the place I go through, which is within my job, Mercy, they have trainings. So I attend them like different trainings, like about what's new, what's coming up, from prenatal care to well women's things. And of course, working with groups like ILPQC and things to know the latest and what's been approved or what direction even the states are going to.
What is that? ILPC?
Oh, I got you. So the Illinois Perinatal Quality Collaborative, and Missouri has one as well. Missouri PQC, same thing, Perinatal Quality Collaborative. And so being on a lot of these calls, being a part of a lot of these learning initiatives, Illinois Department of Public Health, IDPH. So there are monthly seminars and calls and things to help us know like what's going on, what's the latest, in your state, everything from care to laws.
And every state has this?
A lot of states have them. Not every has a PQC, but there are quite a few. Like I can name some, like Tennessee. And when we have these big conferences, a lot of people from different states come and talk about the things they're doing. I believe like New York has one. I want to say out of the 50 states, maybe 30 to 36 have them. I'm not 100% positive, but there are many like that don't and really could use them.
And then how do you get access to that?
So these are public. You just kind of honestly now, although I said don't use Google, but if you Google like your state and the PQC, it should, if they have a website up, because some of them are smaller than others. Don't get me wrong. I just happen to be a part of two very large ones. But you can go on their website and they will literally send you the information to sign up for those monthly meetings where you can even be a patient partner, right? To help improve these perinatal outcomes by talking about your experience. A community partner, if you have a small business or so that surrounds this perinatal health and care, you can, again, reach out and be on these boards. They have like OB boards. I'm on like an OB community advisory board, neonatal boards, newborn boards, childcare, things of that nature. But if you have one in your community or in your state, and even if it's small, being a part of it can help make so much change and really help it grow. So I definitely recommend reaching out to them. It's been very life-changing and really changing the scope of like maternal health care and getting some changes going.
It sounds like it. As we start to close out, if you could just tell us how you're supporting your mental health this last semester and the biggest challenge.
How I've been supporting my mental health is honestly being intentional about taking time for me. I have a habit of giving my all until I have nothing left and then some, and not refilling my own cup. So being intentional about saying today is the day I really am not going to work on anything. I'm going to sit back and I'm going to relax, right? Being more intentional about me time, reading, spending quality time with family, definitely spending quality time with my son, because over the years of going back and forth to school, that is one thing that I have beat myself up the most about, feeling like I haven't been present enough as mom, right? Taking care of home is one thing, but being present as mom and really making sure that I'm a part of his growth and becoming a person. So that is something that I've been super intentional about. And I would say, honestly, my biggest struggles throughout this entire experience, not just this semester, from school to entrepreneurship, would be thinking I was a bad mom, because I have become, and I know it, like so hyper focused on this success. And in your mind, if I just get here, then I'll be able to do all these things for my child, which you're talking like financial things, right? And finances is important. But I found myself so hyper focused that I forgot to be his mom. So I will 100% say, in all transparency, it would definitely be giving myself grace to give myself time, and giving myself time to be mom for my son and not just provider.
Thank you for sharing that. And a lot of listeners can totally relate to that.
You're welcome.
And what does that relaxation look like for people who aren't familiar?
For me, and I will totally say, guys, it has to be what you do for you that makes you happy. I am a book reader. I love to book thrift. I book audio. So the amount of joy I get being able to go get a cup of coffee and going to, like, don't let me find out it's a big book sale somewhere. I will drive, right? And
Not the library, especially the library, where they're like $3.
Exactly. Goodwill, honey. I have no shame. I'm going wherever I know books are for sale, right? And so I get so much joy. That is like my Super Bowl. Okay. Going to get some good deals, or even just, as people thought it was weird when I was saying it, just to be able to walk in Barnes and Noble and just smell, literally, something about that comfort that new books give me, even if I don't buy any. I just went and took a walk through there and I just calmed my mind and soul. So that, and being able to just like exercise, like go to the gym for like an hour, and it doesn't seem like much, but for whatever reason, it is so hard to force yourself to get up and get that in, just to relieve stress. So for me, those two are things I've been able to give back to myself, and a pedicure here and there, because I got to keep it together. Other than that, I always tell people to each his own. Do more of what you love. So if you like to cook, you like to paint, you like to draw, because you're multi-talented, right? You're not just that one thing. And so being able to separate yourself from that one thing, which for me would be like being Doula Bean and doing something just that simple for myself, is what I desire.
Yeah, I love that. When it comes to the pedicure, right? Maybe you don't, finances are a real thing is for students, right? And so
Yes.
maybe you can't afford a pedicure out in the salon, but maybe you can buy a little bit nicer nail polish and do it yourself and
Hmm.
play some music, watch your favorite whatever, and do your own nails. Take care, like
Yes.
really self-care, take care of yourself. Through school, I did everything myself, my hair, my nail, you name it, I did it,
Yeah.
right? And then since you're a book reader and you love research, and time is limited, right? One
Yes.
thing my hack is the Adobe app. You can upload PDFs on there. They're the little three dots in the right-hand corner. There's a read aloud feature, and I
Hmm.
can consume so much content when it comes to research.
Yes.
And so it's wonderful. And it's free.
I will be downloading that because that has been a thing. I love Audible, things like that. Because again, I'm on the go.
Yeah.
So to even be able, even in my room at night, if I'm just sitting there listening for an hour, and I love my research, of course, but to every once in a while, I read something I just kind of really just wanted to read. Like I just finished the 3 Mrs. Gray series, and I'm like in my headphones, listening like, oh no, they didn't. Right? It's just been great. So yes, love it.
And then on staying active, it can be challenging to get to the gym. And I know a lot of people like myself invested in a whole bunch of equipment during the pandemic. My newest piece, though, that I want all of us who take care of people to think about is the walking pad. It's less than $200.
Yes.
You get yourself a standing desk because when you think about how much time you spend on this computer, running your
Hmm.
business, studying, all the things, it's hours. It's
Yes.
literally hours. And if you could get some calories done, if you could just get movement, blood flowing, we get venous stasis in our legs from standing and sitting for long periods
Yes.
of time. To me, it's worth the investment. And then if I don't make it to that hour, 2 hour session, then I don't feel so bad. And I'm still I'm still meeting the goal of taking care of myself. And then when I do get time to work out, I get to spend more time lifting weights.
No, I agree because I've been more intentional about paying attention, like getting those steps in. So I
Yeah.
100% agree. Like I'm at work using that free Stairmaster. I'm taking the stairs. So I agree. That is actually something I asked for Christmas. I was like, I want a walking pad. I really want a walking pad, guys.
Well, 3 takeaways for other midwife students as we close out.
Self-care. Definitely self-care because as much as we love this work, you will get burned out. So that is literally one of my numero unos. Make time for yourself, make time for your family. And gosh, what else would I say with this? If it's not a labor of love, it's just labor. And
Oh,
so keep that it really and nobody wants that, right? Like if you're not doing this out of love, you're in the wrong business because you're literally a part of the most vulnerable, most sensitive times of people's lives. And if this is something that you go into with like a mechanical mindset and you can't see people for people, because I don't care if it's the same room, same induction, whatever you got going on level here, you've done it 100 times, that is still a new individual. And you should really look at them individualized and give them that love and care that they're going to need throughout this entire experience. Like put yourself in their shoes and how you would want somebody to be there for you.
Charity, we can't thank you enough for allowing us to share your journey, for taking some time out of your busy schedule. And for me, the most, I think, fulfilling part of this is just to see how happy you are.
Thank
Because
you.
school is challenging, right? You have a lot on your hands. And so to see that the time that you're spending, you're getting that joy, you're getting the support, you're seeing people who look like you doing this work, it's so encouraging. And you pointed out the things that are really important: family, humanity, and self-care.
Yes, thank you. And thank you again for having me. Always a pleasure to be on the show. Thank you.
Yeah, we look forward to seeing you next semester and hearing how things have changed, how your perspective on the system has changed, and all the helpful resources that you're going to identify that's going to help someone else do things a little bit more faster, a little bit more smarter, so that they can also have the time to be present, take care of themselves, and be successful in the work that they're trying to do.
Thank you. I can't wait. Can't wait to tell you how many babies I've caught. I'm excited. Can't wait.
I love that catching babies thing.
Thank you. Yeah, just like, come on down. Catch them right there. Like, oh, got them. Because, I mean, that's really all we're doing. I'm not pulling them out. I'm not birthing for you. I'm just right there to catch. Like, here we go. And that's it.
Well, thank you. Remember, everyone, you can send us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, this is your chance to subscribe, leave a comment or two on YouTube, LinkedIn, Facebook, Instagram, TikTok, or any of your favorite podcast apps. We especially appreciate if you could take the time to rate us on Apple and Spotify. It lets the algorithm know this information is important, so that when people like you look for topics like this, we show up higher in the search results. All the information we mentioned today, how to connect with Charity, all social media links, any of the resources that we mentioned, you'll find below in the description box. We release new shows weekly on Sundays at noon Eastern on LinkedIn, Facebook, Instagram, and then release the audio at 5 a.m. so that our night shift friends have something to listen to, and they're the first to get something and not the last. Our day shifters can listen, and then maybe one day someone will play during huddle and tell us about it. We thank you all for watching. We'll see you next time.